Hey, my name is Zachary Johnson, and we're going to be going over how to do orthostatic blood pressure today. I have a patient here, and we want to keep two things in consideration here, what we're looking for. We're looking for a drop in blood pressure of 30 millimeters of mercury or more, or 20 beats on your pulse rate or more. All right, so I'm going to go ahead and have my patient lay down. We're going to do our baseline vitals here. That way so y'all can see me here. Okay, then we'll check my patient's pulse. Now, we're going to wait for 30 seconds before having our patient sit up to check our second set of vitals here. After 30 seconds, we'll recheck our patient's blood pressure. Now, I'm going to check her pulse rate. We'll wait another 30 seconds, or you would wait another 30 seconds, and then you'll have your patient stand up. Okay. We're going to check for her pulse rate again. Okay. So now I'm going to break it down for you. I have my patient lay down. Now, some things, like I said, we want to consider that your patient might already be supine, and that's fine. Some patients might be immobilized or paralyzed, so keep those also into consideration. But once again, we're going to start off with a good baseline. We're going to put our blood pressure cuff around the patient's arm. Make sure it's nice and snug and properly where it needs to be. Then, I'm going to check my patient's pulse. Then, I'm going to have my patient wait 30 seconds before we sit up and take her blood pressure. So after 30 seconds, my patient would sit up. Obviously, if she was to feel dizzy or lightheaded after doing that, we could probably assume that she's dehydrated. And it might be in consideration not to stand her up at that point, okay? So what I'm looking for is I'm looking for a drop in her blood pressure, 30 millimeter mercury or more, okay? And then I will be checking to see if our pulse is going above 20 beats per minute. Okay. Now we're going to wait 30 more seconds, and then we'll ask our patients to stand up and take our last set of vitals. Just stand up with me. Like I said, if your patient upon sitting up is already dizzy and lightheaded, it's probably a good idea not to have them stand up. A drop in blood pressure could cause a syncopal episode, okay? All right. Now, you take this off and check for a pulse. And there you have it. I'm going to run through one more time how to do orthostatic. I'm just going to go through the process. Have my patient lay down. Just want to get a baseline here. Okay. Check for a pulse. Thirty seconds go by, I have my patient sit up. Check our pulse. After 30 seconds, I'll have my patient stand up. check the pulse one more time. And that is it. Like I said, two indication is 30 millimeters of mercury of drop of blood pressure or 20 beats per minute or more. Special considerations could be, is your patient already laying down in the bed? Is the patient, when you sit her up, is she already dizzy? So we don't want to possibly cause a syncopal episode. But that is how you do orthostatic blood pressure. Thank you for your time.